So today I have Juan visiting. Juan has been a patient of mine for a pretty long time. I think 13 years?
Yeah, somewhere
Juan?
around there.
13
yes.
years? 14 years, something like that?
Somewhere around there, yes.
And you came to me actually for your son, right?
Yes. I have a son who is quadriplegic. We were involved in a car accident, and he's not able to walk or move or talk. And I found out that this guy can adjust his back, and I was kind of skeptic.
You were skeptic, I remember. You remember I actually have OJ's video?
Yes.
And you guys were visiting, so if you look at OJ's video, there's you, your brother, and Themo are in there.
Yes.
And I remember that was your first day for you to kind of see, is this something that you want to actually get into?
Right. That's right. So after that, I guess I developed a trust and see also
you
the benefits.
guess you developed a trust? Really?
And the adjustment that he did on my son, that were good. So especially promoting his bowel movements, because he, as you know, a person who is bound to a wheelchair, can have some constipation problems. So it was good
because of lack of movement.
Right.
Okay. And we saw Temo back then for a while. You've been coming in periodically, right, for tune-ups?
Yes.
And somebody had asked, do you mind sharing? Somebody had asked, actually quite a few people had asked. I got a bunch of messages and emails, and people were asking, can chiropractic benefit someone who's had an amputation? And Juan's story was that, right? You were in an accident a while back, and both of you you lost the right leg, and your son developed brain injury right from it. But through this process, one thing that's pretty amazing with this guy Juan is he don't give up, and he takes care of his kid better than almost anyone I've seen. Does his treatments, his therapies, he just doesn't give up on his son, and that's a blessing. That's his son's blessing, number one, and number two, it says a lot about the character. And one of the main reasons we're sharing this story today is also for people who, let's say, have had some sort of amputation or prosthetic, and maybe they're getting aches and pains. You want to come over here and we can kind of scope and see what's going on? And they're getting aches and pains, and it's not just about medication, right?
Right.
And the wheelchair also sometimes can cause stuff. Like I remember your shoulder, something went out, shoulder, elbow. We were dealing with an elbow for a while, right?
Right.
So I'm getting about a 6-7 pointer C1. I'm getting about a 9-10 pointer around T6, T7. And what seems to help Juan out the most is when we're down here around S2, S3. You know what?
That's correct.
And it took us a while to figure this low back out. He had an episode last year, I remember. It took us a couple of months, right?
Yes.
And we ended up having to do a new x-ray, and it was as simple as moving down 2 millimeters and torquing it the opposite way. And that seemed to change everything for him.
Right.
Correct?
Yes, sir.
Yes, sir. So we got C1, we got around T7, we got around S1, probably S2. Let's check first down low. Numero 5.
Ow.
Ow. Sorry. Numero 5. S1. S2.
Ow.
That's the one. S1.
Ow.
S2. Ahí?
S1.
S1 today.
Ow.
Okay. Let's continue. 1, 2, 3, 4, 5, 6, 7, 6, 7. I feel right under 7 there on the left a little. Not so bad though.
Nope.
Okay.
Not too bad.
Let's wait. Let's leave that. Let's work on C1. Let's work on the sacrum. We're going to go to the high-low first, okay? And let's go over there and do C1 and sacrum. Let's transfer, please. Oh, good. You can smile.
So for your
What?
people who asking if they can have an adjustment with
Yeah.
amputees,
Yeah.
I mean, totally recommended. I believe that a lot of my back problems are from not having my leg and being sitting, and also the activities that I do.
Mm-hmm.
So I highly recommend it because it really helps me. Now I just come after like tune-up.
You don't
Give it
come
6
in, I
months.
see what, yeah, 2-3 times a year now?
Mhm.
Just for a tune-up. This is not a weekly
Yeah.
thing, this is not a monthly thing. This is, you know, he comes and gets dialed in a couple times a year, that's it. Now we're gonna do S1.
Now I had to be quiet and try to concentrate. Oh!
Poquito.
Ah!
Gotcha.
Ah!
Gotcha. We're gonna come up, okay?
See the
You gotta talk with him too. You can't like tell him what you're gonna do. You gotta just have a conversation and do the job.
right.
You know, there are some people, and it's not just him, there are some people, they get very tense in anticipation. And so part of my job is doing what? Distracting you, right?
Exactly.
And that seems to work. Sit back for me, sir.
So you probably heard this pain expression, but you know it's going down, but it's a great relief in my back. You know, just give it a couple of minutes, and after that, you know, I'm very grateful.
And we don't hold back, do we?
Nope.
Right? That's a little bit. Let's go back on the orange table, please. I was trying to be nice, Juan. It doesn't work. You know, I ask people, you want me to be nice and sugar-coated, or you want me to do my job?
Yeah, I did your
You gotta do my job, okay?
You gonna go on the side?
Yes.
Right side?
Right side, sir. Okay.
No.
Is that okay like that?
Yeah.
Are you feeling
No, no,
twisted
no.
at all in the
No,
body?
no, I'm good.
Can we slide up a little bit more, please? Poquito más? Bueno. Bueno. And we need to get right in the atlas. I'm gonna just raise it up a little bit to get in. There we go. Left hand up here, please. Home run. Beautiful,
See, I
sir.
wasn't even expecting it.
You see?
You got it.
Patos locos forever. All right, you need help? You're good?
Got it.
I like Juan. He's a trooper. He's independent. He handles his business. He takes care of it.
So see now the pain that I felt at the beginning when my adjusted happened is gone already. So
Let's
Okay.
rescope you, and let's see what we got here. So up at the top, atlas is clear. Now we didn't touch the mid back, did we?
no.
And it's clear. Good stuff. Ah. Low back is clear. Now let's just feel it, make sure. L5. Back towards me, please, one. Good. 5, 1.
Good.
Bueno?
Yes.
Now, we have also adjusted him side posture sometimes when he gets very stubborn. Sorry, when his body gets stubborn on us. Scoot back, but he adjusted very well. The only difference that I did is even though I went up to S1, typically S1 is a clockwise torque, but for him it's a counterclockwise torque. And that's just the specifics of his case. Everything else feels good. Turn. turn, bend left, bend right, sit up straight. Let's work on your shoulders. Over, round, down. Over, round, down. Breathe. There you go. Ears. Well, and elbows. Squeeze. Elbows good. Squeeze. Squeeze again. Squeeze. Just a tiny bit on the lunate and scaphoid. Lunate. Scaphoid. Squeeze. You're all set, my brother.
Thank you.
Questions?
Yep.
Welcome back.
Appreciate it. Again, I highly recommend it. Do not be afraid of, that you're gonna get hurt. No, the contrary. Again, I believe it's because, I'm even, because my leg is always down. That's one of the things that I can think that is my lower back problems. But see, I won't be back probably, maybe I'll get another adjustment next week, just because I'm going out of town. But then after that, it's gonna be another good 6 months for me to come back. So,
Because we have no space. I'm joking. I'm joking.
but no,
We always
definitely,
got space.
please, if you have a chance, give it a try.